To increase access, we have so many different areas of care. We have mammogram places in malls. We have communities that have mammogram vans, not so much since the pandemic, but vans that have picked up again, especially in lower income areas. Um, PAPs and access to the physician offices need to be open. They have been reopened since COVID, but I think just the explanation, you cannot imagine how many women come in for PAPs and have no idea what that means. What is the word PAP? Anytime they go to the emergency room and someone checks out their pelvis, they assume that that was a PAP test, not understanding that a simple pap test is a test to detect cancer. If you ask 10 women, what is the pap test for? I don't think 7 of them, maybe 6 of them might tell you that it's for cancer. So explaining the why behind it gives more access and it allows people to want to do it. Unfortunately, I'm always an advocate that someone needs to be with you during a doctor exam because they need to advocate for you. Again, when I go to the dentist, I have braces, I get nervous, and everything that I think about asking goes out the window. Now you can imagine, I think I compare myself to a dentist. I say open and relax. Same thing. But when people come to the gynecologist, everything goes out the window because it is a nervousness no matter what kind of specialty area you're going to. And having that support person is key, I believe, to getting culturally competent and quality care. Someone that can say, hey, I don't think that that was the right answer, or hey, let me explain what the doctor just said. I know that doesn't it completely explain how we increase access, but I think people need to know the why before they even seek out the access. And knowing the why behind everything is first and foremost, in my opinion. Historically, Black women have a higher incidence of the worst type of breast cancer. Cervical cancer was decreasing in this country, but because of COVID and the lack of care and the lack of people going out for the HPV vaccine, which is something else, vaccines that some people think are taboo, the rate of cervical cancer, once again, is increasing in this society. So that is why it's more important for Black women, because we always are on the low end of the spectrum when it comes to any kind of chronic disease process. We are the last on the totem pole as far as survival and as far as treatment.